There's no question that stress has accompanied the COVID pandemic. There has been a spike in those 18 and under seeking mental health help. One member of the CHI mental health team has a logistical reason.
Access. Telehealth is a great resource that provided increased access for patients and families. We weren't really utilizing it as much prior to COVID. However, it really prompted us to optimize the use of telehealth.
People were shut in and needed some kind of connection.
During the pandemic, a lot of folks were quarantined. There was a lot of remote learning happening for students. And so telehealth really gave access, to students and families, during that time. So that's a big reason, I think.
Besides the quarantining and remote learning, there was this.
Persons were socially isolated, and social isolation can lead to increased depression and anxiety. So those would be some of the primary reasons that I would believe contributed to those numbers.
Another thought is that there's many factors that come into play.
The biggest reason is just a disruption in their everyday routine. You lose a lot of support when you're no longer able to go to school if that area was on a shutdown or did remote learning or what have you.
But things like school can be a two-edged sword.
School can also be a stressor, but it can also be a safe place. Oftentimes, school is some people's really only break from the monotony of whatever social stressors are going on at home. And so any disruption in that.
Change is disruptive. Abrupt change can be worse.
When COVID happened, I think it's only natural to see when routines change and all of a sudden this support network or even sports or after school clubs or you name it, when that all goes away, because most depression and anxiety, there's a huge environmental component to it. And so if your environment is a not favorable situation, your propensity for depression and anxiety are so much multitude higher. And I think that kind of makes sense when you break it down and think about it.
So what can you do to manage all of this?
Self-care and stay connected. Those are two things that we can all actively do. We're all in this together and to support each other. You're not alone. And never give up hope. It's going to get better. Just going to take a little time.
It's okay to not be okay. I think that we all think about pre-COVID times or even times prior to that, and we hold it with such nostalgia that if we could only get back to feeling this way or being this way, then everything will be better. So I think there's always an inherent push to do everything in our power to remedy whatever we're suffering from mentally. And it just doesn't work that way. These things are a slow progression in one way, and then they're a slow progression in the other way. So I tell people, and much like Tim kind of already echoed, is that you just have to weather the storm.
Both say if things get too heavy to manage, please start with seeing your primary physician. Thanks for watching. For Papillion Now, I'm Tori Pantalian.